And today we have our monthly user group. Uh, we're going to cover ICD-10 and other agendas that we have. Okay, this is just a disclaimer. Anything that you learn today or information I give you, you need to verify yourself. Otherwise, cannot be held responsible for any loss of income that you might require. The agenda today is ICD-10 Get Ready. I'm going to talk. I did send out yesterday a white paper checklist of things that you need to do for ICD-10. I'm going to share my email at the end of the seminar, and you're welcome to send for the operator, and somebody will help. Okay, so let's get started here. And so now, most of you probably will know already when you look at ICD-9 what it looks like. It's a category of 3 digits followed by 1 or 2 digits after the decimal. And we all know when you look at an ICD-10, it's always going to start with a character followed by 2 numbers, then a 3-digit, and a possible extension. Now, don't shoot the messenger. Why ICD-10? The ICD-10 is we don't have enough diagnoses to be able to measure the outcome of a patient and measure the health population and be able to help patients better to improve their outcome. So don't shoot the messenger. We also trying to catch up with the rest of the world. ICD-10 has been around for 11 years now. So the checklist, and I will be happy to send you the white paper I did. So there's internal training. I'm going to share with you some resources for internal training. There's software upgrade. If you're not on version 19 or 20, you will need to have an upgrade for your Medisoft. If you're on version 19 or 20, then you're good to go. Certain features today, I'm going to talk about version 20, so you will need to upgrade to version 20 to get those features. Then we're going to talk about the IT upgrade. So if you are not on version 19 or version 20, most likely you will need an IT upgrade. So version 19 or 20 will not work with Windows XP, and Windows 7 might not work with the certain memory or processor, and so the version 19 might not work with certain memory and processor. So you will need to upgrade your server or upgrade your workstation if you haven't not done that already. We need to take a look at your super bill. If your super bill has the old code of ICD-9, you will need to reprint it. So if you reprint that super bill, you have to think about so do you have now, how many codes you use today for ICD-9 that you have it listed? Now, not everybody has the ICD-9 listed on the super bill, and neither that I'm recommending that you should do that, but for people that have the ICD-9 listed on the super bill, so most super bill, they have just CPT codes or procedures that they do or lab tests they do for the patient. But certain practices, they will list their most common used diagnosis. And the physician will just circle the CPT code, they circle the diagnosis, and they give it to the biller. Now, think about this. So if you're a piece of one sheet of paper that you were able to list the ICD-9 on it, is now, if you had 10 common diagnoses, now those 10 became 50, are you going to be able to fit those 50 on your sheet? You might not. You might not be able to do that. So we need to think about different ways. Some other ways is you will have a room there for a type diagnosis. So you're not circling, you're typing the diagnosis. Now, I want everybody to avoid to have the physician depend on the biller to translate the ICD-9 to ICD-10. It's not going to be that easy because the ICD-9 was non-specific. The ICD-10 is very specific. There is severity, there's laterality, and there's recurrence. So only the physician will know how to code that. And don't ever depend on your software or your biller to translate that for you. It's a huge liability risk there. So I want every physician to get trained and to find a way of how you're going to handle the work process or the workflow in the practice, so you're not waiting till October 1st and finding out that it's not working out. So think about, so what are you doing today? Are you typing the ICD-9 or are you circling the ICD-9? If you're typing the ICD-9, then you need to figure out is if you reprint your new super bills, are you going to have enough room to accommodate all the new ICD-10 that we're replacing the ICD-9? Or you have a place there for just typing the ICD-9. Now, I highly recommend that each physician will use an app through maybe an iPad or iPad mini or any other handheld device. Get an ICD-10 app, and with the ICD-10 app, if the physician typed there the ICD-9, they will be able to make a decision which ICD-10 that you're going to use. Type it on the super bill and send it. I'm going to, now the alternative of that, of course, if you have an EMR, if the EMR, as you doing your note, then you will be able to diagnose. But if your node generates an ICD code, then you need to think about, do I need to redesign my template to reflect on the new ICD-10? So that can delay you a lot, because those type of templates are not easy to customize, or takes a long time to customize. So make sure you get a head start on that. And you can have two sets of templates. You can have an ICD-9 template and ICD-10 template, or depending on what EMR you do, there's some just EMR has a link there to the most common template diagnosis, and you just pick from the list. So think about it. Are you doing electronic? If you are, do you need to modify your template? If you're doing paper, if you are, is your diagnosis listed on the paper? And if it is your new diagnosis going to fit on the new sheet if you redesigned it? If not, consider just to have a blank space there where the physician type the code, not the description, the code, because the description will be a lot harder for the biller to figure it out. Then I'm going to also show you a new method using Medisoft of what it looks like. So lookup resources is really having an app during the time of service with the patient that you, as a physician, you're able to look up, and you will type it on the super bill. Now, I highly recommend an iPad mini or an iPad, because if you use an iPhone or a smartphone, patient might think that you are actually doing something personally. So the iPad or iPad mini will look more official, and than using an iPhone. And probably the iPhone, you will get distracted. Maybe somebody will be texting you, the kids or the house or anything like that. So that's really up to you. But test it now. You don't have to wait until October 1st to do it. Now, also, you need to make sure that you're sending the claims with using Revenue Manager. If you don't know what Revenue Manager is, you probably don't know, you don't have it. So your ICD-10 codes, yes, you can be on version 19, you can be on version 20, but if you don't have Revenue Manager, that means you're sending what's called a print image, and the print image is not going to be compliant with ICD-10. You need to stop and call us and let us fix that for you. There's a fee to do that, to switch you from a print image to Revenue Manager. And we need to do it on each computer that sends a claim. So if you're a billing company and you have 20 billers and 20 computers, so you need to, we need to do that. Okay, so it looks like, all right, so the other thing that we need to talk about is, okay, so somebody's asking, Debbie is asking about, is there an app that you recommend for ICD-10? Very good question. I have not really, I recommended something called Precise University. Precise University, I'm going to show you a link for them, and it's on my white paper. Precise University has an online training. It's a very uh, um, detailed training, and the beauty about their training is specific to the specialty of the physician. I attended a lot of training where all they do is just scare you, uh, but Precise is actually they jump in, peel the onion, and explain to you, and they train physician based on the specialty. Training by specialty is about maybe $3,000 for you and for the physician and for the staff. IT investment, you might need a new server, you might need a new computer, so that might be another $4,000. The software upgrade, of course, it depends on what version you're coming from. So I would say $4,000 depending on what version you're coming. So this is an average for a practice size 5 to 10 computers. Uh, then if you need to read process analysis, if you need to customize things or to print new super bills, so there's some money investment there. Increased cost in documentation. Documentation might slow you down. So if you need to document, depending on your specialty, of course, if you need to have to worry about more detail, they haven't something you haven't done yet. There's a lot of physicians been documenting the right way for ICD-10. They just didn't have the codes for many years. So depending on physicians, and some physician might find out it's a lot easier to have an EMR to use it with ICD-10 than to have to come up with the codes themselves. So depending if you have an EMR or not, or you need to customize your templates, so I added some codes there. So